Okay, so this might be one of the most important videos I posted because it really will try to illustrate something about a refinement in Invisalign treatment and dispel a really important misconception that I think is stopping a lot of cases from finishing in the efficient manner that they really should. Here's a case that started with moderate to severe lower crowding. I asked for 27 active aligners. This is the shape of the last aligner. Now, the shape of the last aligner or the stage in the ClinCheck, that's synonymous. The stage in the ClinCheck is what is used to make the aligner. So now the patient came in the other day. She started treatment 28 weeks ago, and her aligner was fitting beautifully. She's been really cooperative. And yet, this is how her teeth looked. Now, the reason for this is because the aligners are guiding and directing the teeth, but the teeth are not clamped to the aligner. So, what this means is that the aligner that the patient is wearing, that was shaped like this, is actually a little bit ill fitting on the teeth, even though it was down all the way, and even though the patient wasn't complaining. But here's the interesting point. There's a concept in biology called attenuation. It's when you sort of adapt to a negative environmental effect. And so each aligner was clearly moving the teeth. Look where the teeth started, look where they are now. So it was working. But basically, you see how it has fallen behind and fell behind the final destination. That was happening gradually through every aligner. In other words, the first aligner in the first stage of the ClinCheck maybe moved the teeth 99% of what you see. Maybe the second one moved at 98%. And maybe the teeth were the aligner was fitting less well as the teeth fell behind, but the patient attenuated to this because it was such a gradual diminishment of a great fit. And so now the patient looks like this. And they've been used to wearing an aligner that is not ideally fitting their teeth on a microscopic level. And that translates to tightness. Anyone who, if you're an orthodontist, you understand this, or if you're someone who hasn't worn your retainer, if you put something on your teeth that's not kind of that close to your teeth, it's going to be tight because there's going to be a differential. But the first aligner that the patient is going to get from the refinement round is going to look like this, except for watch the change of the first stage of the first refinement. 1, 2, 3. Okay, you didn't even see anything. There's 2, there's 3, there's 4. I move teeth very slowly with aligners. So the first aligner she's going to put in is going to feel great because it's going to fit perfectly. Now, you think that's good, right? But the problem is it's going to fit so well that the patient will not feel any of the pressure that they have acclimated to and attenuated to that has become their baseline. Why is this important? Because when the patient puts the aligner in, they oftentimes immediately say, nope, 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 this isn't doing anything. And when patients are wearing aligners that are not putting force on, sometimes they feel like it's not doing anything, and then they don't wear the aligner enough and they take shortcuts. Remember, they're probably really happy how their teeth look now. And so they don't feel pressure and they don't see anything after 2, 3 weeks, and then they just don't wear it enough. And then you can't even finish what this little bit that's left to go. So you must tell before you put the aligner in the mouth, this is not going to feel tight. It's going to feel nice. Some people describe it as light. Some people tell me it fits better or lighter or thinner, actually, I hear a lot. Because the aligner that she's been wearing that is shaped like this is not adapted to the teeth perfectly, or else her teeth would look like this. And therefore, it's kind of thicker. So it's thinner, some people say. But if you explain this afterwards, it sounds like you're making excuses. You don't have the credibility. So prepare your patients that the refinement tray is probably going to fit not tight, but that is by design, and that is okay.